And let us take this opportunity to show that we, the Conservative Party, truly are the party of the workers, the party of public servants, the party of the NHS.
Imagine accident and emergency closed at night. Well, soon it might be a reality as hospitals struggle with lack of staff, money shortages and increasing demands from patients.
Hospitals in England have had to suspend maternity and other urgent services because of a lack of staff, ITV News has learned.
Latest figures on the state of the NHS released today, revealing that January was the worst month on record, more patients waiting in A&E than ever before.
First this morning, a recruitment crisis in the NHS. More than two-thirds of trusts and health boards in the UK are actively trying to recruit from abroad as they struggle to cope with the shortage of qualified staff. Tens of thousands of NHS nursing and doctor posts are vacant. The figures obtained by the BBC show that in December of last year, the NHS in England, Wales and Northern Ireland had more than 23,000 nursing vacancies. That is 9% of the workforce. More than 6,000 doctor posts were also vacant. That's 7% of the total workforce.
So what's the NHS said about those findings, Rachel?
Well, it's interesting, isn't it? Because during the junior doctors' dispute, we heard repeatedly, didn't we, from the Department of Health, that understaffing wasn't a problem.
If we are stretched even more thinly over 7 days, I'm certain patients are going to die. This is what they're saying.
It's very difficult now for the Department of Health to continue dismissing these staff shortages. In fact, many chief executives I've spoken to said if they are not confronted, we are going to see more of these suspensions.
We asked every hospital in England if they'd suspended any acute services due to shortages of doctors and nurses in the past year. Of the 112 who responded, 16 said they had, on some occasions repeatedly. Among them, Airedale NHS Trust, which suspended maternity services 11 times in 12 months. East Cheshire, which suspended its maternity service twice and paediatric services 19 times. And the Princess Alexandra in Essex, where the stroke unit hasn't opened since April.
Well, I think one of the first things that the government has to think about is that how has it managed to disincentivise what are the most altruistic, most well-qualified, most intelligent workforces that are in the country. Since the age of 16, these people have been wanting to go into the health service and now they're wanting to leave it early.
Mr Hunt has made me feel demoralised, insulted and cheap. He implies we're the problem. When I give my life to the NHS, it's so grim on the front line now, I sometimes work 14 or 15 hours straight without a second even to eat. I have never felt so despairing or so close to quitting medicine.
And you've reappointed as a health secretary someone who has demoralised the entire workforce of the NHS as somebody. So it seems like you stand up and support somebody who has caused junior doctors to go on strike, who seems to be allowing the nurses to soon go on strike. And that doesn't seem to fall in line with what the front line of the NHS want to see.
It's not exactly unprecedented. It's pretty rare for junior doctors to go on strike, Prime Minister. It was under the current Health Secretary.
Let's move to the junior doctors' strike. There is a central sort of poisonous misrepresentation which I think has made this a particularly bitter dispute, which is your assertion that the 11,000 extra deaths at the weekend are connected with poor staffing by junior doctors in hospitals. That drives them absolutely insensate with anger, and it's not true.
The stats are wrong, and I agree with your point. 11,000 people more do not die at the weekend. The stats cover Friday, Saturday, Sunday, Monday. Yeah. They do not die at the weekend. If junior doctor staffing at the weekend was the problem, they would be dying at the weekend. They do not. The highest death rate in hospital is on a Wednesday. You have more doctors on a Wednesday than you do on a Saturday and a Sunday. Yeah. It is not a weekend effect. It is misrepresented by Mr Hunt, who is misrepresenting and lying, frankly, because when you are told something is wrong and you continually repeat it, it becomes a lie. Right. He is lying about what is happening in hospital.
They are still absolutely furious with you. 98% of these highly educated, hard-working people have voted to strike. And it can't be everybody else's fault but yours, surely.
No, look, I take responsibility for everything that happens in the NHS.
Yeah, well, I was just thinking, in response to what you said, though, we've had lots of A&Es and GP practices close across the country because of shortage of staffing. I've actually witnessed organ transplants being cancelled because there haven't been enough nurses there to provide post-operative care. So whatever the government is doing, it's clearly not enough.
Record numbers of doctors doing their 2 years basic training and then going off to find a job somewhere else, because 50% now leave to do something else, don't go into the NHS because they are so horrified and demoralised before they even start.
I just wanted to ask you, because I know you were just saying then, you know, your job doesn't necessarily make you popular. You're certainly the most unpopular health secretary in recent history with medics.
Andy King, a registrar from Oxford, with so many patients to see, I'm absolutely petrified. I'm too exhausted to look after them safely.
Now, I've personally dedicated the last 12 years of my life to a career in medicine. I'm a paediatrician, and it's quite sad, actually, because I'm now at the point of seriously considering resignation because things have gotten so bad on the shop floor.
The profession is at absolute breaking point. I see doctors in tears because they are so despairing about what the future holds. Jeremy Hunt has done this. He's driving away a whole generation of doctors. Those are the voices of doctors right now. That's what they feel.
This is about a government and a system that is effectively putting untold amounts of pressure that don't need to be put on these doctors, because the system is being mismanaged.
A Freedom of Information request by BBC London to all of the capital's NHS trusts showed that in 2011 over 1,200 days were lost through doctors being signed off with stress, anxiety and depression. Last year, though, this figure had jumped to nearly 3,200, an increase of 159%.
Mr. Speaker, 1.8 million people had to wait longer than 4 hours last year in A&E departments. Now, the Prime Minister might not like what the Red Cross said, but on the same day, the British Medical Association said conditions in hospitals across the country are reaching a dangerous level. The Royal College of Nursing has said NHS conditions the worst ever. Royal College of Physicians has told the Prime Minister the NHS is underfunded, underdoctored and overstretched. If she won't listen to the Red Cross, who will she listen to?
The warning lights are flashing in England's NHS, a service having to save £22 billion in 5 years, while dealing with chronic staff shortages. Leaked plans reveal that savings means closures.
And those cuts mean, obviously, cuts to hospital services, hospital closures, mergers, and it means the sell-off, permanent sell-off of NHS land and assets. And then the second part of that equation, transformation, really means adopting unproven models of care, some of which is linked to privatisation.
The leaked plans suggest that in northwest London, a £1 billion shortfall would mean cutting 500 beds. In Leeds, 5 wards would be at risk of closing, and the number of acute hospitals in Leicester would be reduced from 3 to 2.
Tell me, the Lincolnshire Hospital is thinking of closing at night. Isn't that an unthinkable thing?
It's absolutely catastrophic. What that means is millions of people in that environment suddenly are going to be denied emergency care. They will go to other A&Es, they will swamp the other A&Es that probably also have gaps in their rotas.
But NHS trusts are in a financial crisis. According to NHS providers, it seems to be the worst financial crisis in NHS history. 80% of acute hospitals now in deficit. There was a time in 2010 when the NHS was in surplus. What's happened?
What has happened in relation to funding of the NHS is precisely this. We asked the NHS themselves to come up with their 5-year plan. We asked the NHS themselves to say what extra funding was needed to deliver on that. They came up with their 5-year plan, led by Simon Stevens as Chief Executive of the NHS. He said it was £8 billion that was needed. We're giving £10 billion of extra funding to the NHS.
We go by the King's Fund figures, Prime Minister. They would argue that the £8 billion that was requested and given to NHS England, if you allow for various other monetary pressures, is actually £3.5 billion. Right, all right. Well, 20 hospitals in England were on black alert in January. I don't know how successful that was.
Why isn't the £350 million, which are getting back, why is that not in control? Why is it not in the manifesto? Why is it not in the manifesto?
It is actually.
It's not there.
And
no,
Theresa May,
she said it.
She said it at the launch of our manifesto.
She didn't.
She said the only way to take...
As I understand it from what you've just told me, that your commitment to this extra money is only dependent on the economy growing at the rate it is now. If that doesn't happen, how are you going to find the £8 billion? Because you do not know for certain what the economy will be like in that time.
No, we don't, but we can have confidence. But if you don't want to take that confidence at face value, Look at our track record.
95% of patients are supposed to be seen within that time limit, and it's simply not happening. Jeremy Hunt says meeting the target is critical to patient safety. That was his message to health professionals this morning. But for patients wondering when that's going to happen, he said potentially in the next year, by March of next year, if all the doctors and management and nurses put all their efforts into it, is what he said. Many health professionals shedding real doubt on whether it can happen even in a year's time. The government have already, as you may know, changed the way they monitor this. It used to be every week. Now it's every month in the hope of having fewer bad headlines.
Among A&E doctors, our survey found 1 post in every 8 is unfilled. Compared to vacancy rates last year, that's 21% higher. And for A&E nurses, 1 in 9 permanent posts are empty, a figure that's jumped up by 44% compared to 12 months ago.
If a GP suspects you might have cancer, you should start treatment, according to the guidelines, within 62 days. In 85% of cases, 79.7% is the lowest on record.
The figures during your time in government are terrible. The latest figures from the Royal College of GPs says the people who've waited a week or more for an appointment has gone up by 50% since 2012. Now, how can you promise almost immediate access to GPs when GPs themselves, I mean, indeed, we spoke to a GP earlier this week who said these kind of promises are just not realistic. They're just numbers you're chucking out.
What those statistics didn't point out is that year on year, since 2010, the share of GDP that this government spends on health has gone down. It is now 6.6%.
We are much,
almost the lowest in Europe.
If you adopt this US model of integrated care and you have a massive program of cuts and centralisation, you will then, of course, get a two-tier service with the majority of ordinary people having to rely on a third-class service and a minority of affluent people being able to get private healthcare insurance. When we're looking at legislation, such as, for example, the Privatisation Act, the Health and Social Care Act we saw in the last Parliament, that's something that's quite abstract for people to grapple with. But when it's the local hospital at the end of the road that's closing, that's something that becomes very concrete, and you see a huge amount of resistance to that, and often those plans have to be delayed or shelved.
Good morning to you.
Morning, Piers.
So, look, the Labour Party have got this outrageous plan to give NHS staff a pay rise you've not given them for years and to make their jobs safer. Presumably you agree with them, do you?
Well, I'd certainly agree that NHS staff do a brilliant job, and we'd certainly like to pay them more than we're able to at the moment.
You haven't done it?
No, we haven't.
The party of the NHS